Hey everyone, Dr. Anthony Cave here. Years ago, I had a patient who I brought into an operating room just like this one. The moment they came on the bed there, I noticed a single tear is like a movie, like rolling down their cheek. It wasn't a crocodile tear. They weren't making a big deal about it. They were almost like ashamed of being so petrified. Now, you don't have to go to medical school to know that you got to take a quick time out. You don't got to be super smart and emotionally intelligent to recognize that something is wrong if a patient, before they're about to go under anesthesia, is absolutely terrified. So I paused everything. I asked, as nicely as I could, given all the pressures of the surgery room environment going on, I asked, what are you feeling? What's going on? They said that coming back into this operating room, the smells, the lights that you see up on the ceiling there, took them right back to the last time they had surgery. I said, oh, you never told me there was anything wrong with your anesthesia or surgery. What happened? They said that they remember being in the operating room with something plastic down their mouth, down their throat. And I'm like, well, that happens in lots of surgeries, right? Here was the problem. No one had told them about the breathing tube. So when they had a small bit of anesthesia awareness at the end of the surgery with the tube coming out, they, one, had no idea that there was a tube that was going to be placed in their mouth, and two, were absolutely horrified to have this coming out of like a blowtorch thing almost out of their mouth. And when they asked their doctor, this is key, they asked their doctor after surgery, what was it in my mouth? I remember there being some plastic in my mouth. The doctor did the classic blow off and said, that's impossible. You couldn't have had that in your mouth. So just to be clear, if someone has any anesthesia awareness, there is a protocol, if you will, as closest to a protocol as we can get of what you're supposed to do. And I got to say, it does not involve in asking the patient to fight to prove their symptoms. It doesn't involve a patient leaving their appointment feeling like their experience of reality was questioned. It includes things like reassurance, questioning, compassion, and urgent psychiatric consultation. Not planting a seed of uncertainty and paranoia that would apparently stay with this patient for 6 years, doubting their experience of what they thought was happening in their body, because one person in a position of power decided to blow it off and not acknowledge it. I don't want to blame doctors. I'm a doctor myself, but I also want to be very clear that you're going to learn today about who is at risk of having misdiagnoses, like in this case of a misdiagnosis of anesthesia awareness, in addition to having an inappropriate anesthetic consent or informed consent. But putting that aside, you're going to learn what the top misdiagnoses are and what the top 3 pearls are that I have for anyone listening here about what you can do to help minimize this from happening in yourself or your loved ones. We're going to end with a live Q&A, and we're going to actually start with the best part first. My top 3 recommendations starts with number 1. Whenever you're in a position of vulnerability where there's a delta between you and a delta of power between someone above you, a doctor, a teacher, whatever it might be, specifically for medicine in terms of a healer, I always want you to be comfortable, to be empowered to ask, what is the worst thing this could be? And why isn't it that? So if you're coming in with chest pain, hopefully it's just something minor like acid reflux, maybe costochondritis, maybe a painful musculoskeletal complaint. Doesn't matter. I hope that you can also feel comfortable asking to make sure it's not heart disease, maybe not something related to a vascular problem. We'll talk all about that at the end. If you're not comfortable asking, or if you're not happy with what the answer is, if you ask a basic question, what is the worst thing this could be, and why isn't it that, then you need to be vigilant, right? I'm going to tell you exactly what you got to do to be vigilant. You may need to look for a second opinion, maybe look for a new doctor. But if you can't get the basic premise of medicine answered in your appointment, then we got problems. I want to take a really quick shout out here to thank everyone who's on here. Heidi, Ariana, good to see you. Brenda, thank you for the kind comments. And yeah, we're going to talk about all these questions at the end. So please keep your questions coming. And if you have felt like you have come out of a doctor's office with your experience of reality distorted or questioned, let me know below, because I am quite confident that my patient from years ago is not the first patient or the last, unfortunately, to have experienced this. So pearl number 2, what does it mean to be vigilant? If you've had an experience that's left you a little bit jarred, which is at least double-digit percentages, at least 10, 20, or 30% of patients. I don't have an exact statistic because I don't think this level of questioning is done with patients, where someone's actually asking them if their gut instinct has been acknowledged, or if they're acknowledging their own gut instinct about something not being right in their discussion with their doctor. We'll talk about the fears and judgments and shame that are often underlying this, are often, I should say, enforced by certain interactions with doctors. But if you need to be vigilant, that means you need to be following up with your symptoms. So for example, you come to the doctor's office and maybe your abdominal pain was written off as the most likely diagnosis, which is in most cases related to indigestion or maybe constipation, etc. Well, if in the time frame that your doctor is telling you your symptoms are not getting better or something's getting worse, you need to be on it with the office and calling ASAP if there are any changes in your condition. Not assuming that, and I don't mean to speak down on doctors or the medical profession, but no one is going to be as in tune with your body as you. Nobody. Because you're living you and you know your body better than anyone else. I'm not saying you know how to heal your body better than anyone else, but you know your body. And with the right introspection, you should have good insight into what your body is doing and how it's changing. You don't want that abdominal pain to end up being something like colon cancer, which we're going to talk about because it's one of the most missed diagnoses. Absolutely tragic, in many cases preventable. Being vigilant means following up with blood tests and imaging results. So when you get that chest x-ray, actually, we're going to go through each of these one by one. That chest x-ray, when people have maybe coughs or vague feelings in their chest, if you're not getting the answer back from your chest x-ray in time, I want you to be confident reaching out. Hey, was my x-ray normal? Maybe there was a nodule on there. This is why lung cancer is one of these misdiagnoses. Not because it happens very frequently, but because sometimes it's maybe the little bit of it is there first. And in a time when it could have been caught early, it was not caught and it blossomed into something bigger that can no longer be treated. You need to follow up with your blood test. So if you have, let's say, that abdominal pain, going back to that, and your blood tests are drawn to look for anemia, if you're not getting the answer back from your complete blood count, your CBC, you need to be calling to make sure you don't have an iron deficiency anemia. Because, especially in older individuals, or if you've been watching my past videos, you know that younger individuals are also susceptible to colon cancer. Iron deficiency anemia is one of the telltale red flag signs in someone who's at risk for cancer, for having a growing neoplasm in their colon. Meaning you need to follow up and not let the system follow up for you. I don't want to put down the system or put down doctors or put down other medical professionals, but if you have your gut instinct a little bit in the wrong way, I want you following up. For women specifically, chest pain in women is far more likely to be confused as a psychiatric disorder than for heart disease, even though 1 in 4 women are going to die from heart disease. Heart disease is the #1 killer of men and women, but men are far more likely to have that accurate diagnosis happen faster. Yes, the statistics are more likely for a man to have heart disease at a particular age with certain circumstances around them. Doesn't mean that women cannot have it, though. So I'm curious here. I'm going to look in the comments again. Who here has ever felt this way, maybe specifically with colon cancer or lung cancer, a chest x-ray? I don't know why I'm getting an eye roll from Spoonless Valkyrie. You have an awesome username, by the way. Just don't know what you're eye rolling at. And like Heidi says, get your colonoscopies as soon as you can. Hopefully insurance will cover them as well. Hey, Lotus, thank you so much for that kind comment. I agree. If you are learning something new, do please like. Skater, surfer, snowboarder, yeah, feeling dismissed is at the crux of what we're talking about. We're going to get to that as well. And Juanita is going through this right now, so Juanita, I appreciate your vulnerability and sharing that with the group here. I hope that you can see that you're not alone in any of this. And leads us to number 3. Sometimes when we are going through this, we lose sight of connecting with our instincts. This is common in my patients with PTSD. If we've been bruised or we've been burned before by trusting our instincts, we're less likely to trust our instincts in the future because we got burned once. That's not right, though. We all make mistakes, doctors, patients, non-doctors, non-patients, but to not trust our instincts when our spidey sense is going in the wrong direction is not doing us a favor. And we need to recognize that if we're afraid of being judged when we are with our doctor, something is not right. If we're afraid of asking questions because we're afraid of being judged as whiny, as being dumb, as being needy, or being weak because of our pain, etc., that is a problem. If you're feeling like you can't share these, that should be ticking off your spidey sense. And you should be able to go back to number 1, which is what? What's the worst thing this could be, doctor? And why isn't it that? Of course, there's other things around chronic pain, for example, that aren't going to kill you imminently the way that some of these other top misdiagnoses can. But if you're feeling a judgment, you need to take a step back and have the confidence to ultimately review the plan with your doctor. Remember, sometimes we can't just verbalize that like, hey, I'm not feeling comfortable, doc. That's not productive. But asking to review the doctor's plan is productive, and it's their responsibility because we doctors get paid, for coming up with treatment plans. And it's absolutely within your power and jurisdiction, if you will, to ask us what the treatment plan is for you. So if you're feeling the concerns around you not understanding what's going on, you don't have to be like, hey, doctor, I don't get it. Because you might feel like you sound dumb, though you wouldn't sound dumb for asking that. But asking to review the plan the doctors know exactly what that means and hopefully can take you further away from that judgment and put you in a place of more objective non-judgment, which is what you deserve when you're coming to the doctor's office. You're paying all this money for healthcare. You better darn well walk out with having some idea of what your doctor is thinking. Hopefully your doctor is thinking. I'm sure they are. I hope so. So if you're learning something new, like the others were saying, please hit that like and subscribe button to keep up with all of my live streams. And please consider joining our private Zoom meetings. The link is below in the description to help be a part of our growing community where we have our Zoom sessions where we can have more one-on-one time or small group time with video. But moving on, who is at risk of being gaslit? And this is important because individuals at risk need to know what they're walking into. That's young women, people who are a color or minorities, especially those who don't speak English. Oh my gosh, think of how easy it is to blow off their concerns. Those who are disabled, those who have I call them the unprovable conditions in some sense, because lab tests and imaging won't necessarily show you the diagnosis. I'm talking fibromyalgia, migraines, chronic pain. You know what I'm talking about. Some psychological conditions around PTSD, the anesthesia awareness. I don't have a lab test that can prove you had anesthesia awareness, right? If you fall in that category, you are more likely to have your symptoms be, quote, blown off, dismissed, not acknowledged, and ultimately leaving you not being treated. So it's a fine line, and please do not go too far in one direction of distrusting all medical professionals, but recognize that it's going to be easier for you to fall into one camp than the other. And please remember that so you can feel more empowered to advocate for yourself. What does that mean? Women, like I said earlier, you're more likely to have chest pain confused for something maybe related to psychiatric disorders than for actual cardiac related chest pain compared to a man. Even though, like we said, heart disease is the #1 killer of men and women. Black Americans, sudden cardiac death is significantly higher in this particular population. Yeah, these numbers are kind of hard to calculate for many reasons, but suffice to say that you are at a higher risk. I hope that you are empowered to ask questions that are related to that higher risk that you are. then there's just the misdiagnoses altogether. The big three that we talk about in the, unfortunately, in the malpractice world. Well, number one involves cancer. We mentioned it earlier, lung cancer. If you had that chest x-ray from years ago and it showed a little nubbin, which I have a personal acquaintance who had this exact thing happen to them, an x-ray for something completely unrelated showed a little nubbin, which turned out to be lung cancer. Thankfully, that was detected and danger was averted, but you can imagine it's easy for that to slide and not have it followed up serially, what we call it, like not like milk and cereal, but followed in sequence to make sure that that nodule is not growing into cancer or to have a biopsy. Then there's colon cancer. Like I mentioned, how many individuals have had blood in their stool and have not had it followed up, where a doctor didn't follow up with it, or that iron deficiency anemia from losing all that blood not being followed up. Breast cancer is another missed one. That's harder because of the wide range in recommendations for mammograms and breast lump, self breast checks. But suffice to say, these are going to be the top misdiagnoses. And if you're at risk for them, which most people are, if you're listening to this, being extra mindful of that they are likely to be missed will help you better advocate for appropriate screening for you. Then there's the infections, number two of the big three. So urinary tract infections, what we call UTIs, pneumonias, and then pyelonephritis, which is referring to infection of the kidneys. Women know about UTIs. They saw my women patients, though, because most of them have experienced at least one in the past. This really becomes an issue in the elderly, where UTIs can manifest with bizarre symptoms, anything from dizziness to brain fog, even dementia. I've had in a couple of patients. Absolutely bizarre what even a small infection can do to an aged brain. Then number three, and this is a scary one, is vascular, specifically if we hone in on strokes, because young people are far less likely to have a stroke diagnosed early enough compared to older people. It's like 7 times more likely to have that miss, largely because young people don't get strokes. So when they present with vague symptoms of stroke, because they have such good brain reserve, meaning you can lose part of your brain as a young person and still function more or less, in some cases, pretty well. It's not like a slam dunk stroke diagnosis like maybe an older person who, if they lose just a little bit of their brain, they're just like completely stroked out, and it's exceedingly obvious with less ambiguity than in a younger person. So if you're a young person, the other confounder here, I got to be honest, is that young people use drugs, and especially cannabis can mimic many stroke-like symptoms in young people. And you got to wait for someone to detox first. It becomes very complicated very fast, suffice to say. But the point is that if you're dismissed, shamed, or blamed, this is not the way to healing. Healing is moving forward, not perseverating in guilt or shame or deflecting blame on others. And if this is what you have felt, I hope you can take those 3 pearls with you, and let's jump right into our comments here. I know there's a bunch that have been coming in. And Noah, I'm so sorry that you've had 2 UTIs in your life. I hope that you were treated for them timely. Hopefully none of us will be gaslit again. CC, I'm happy that you are speaking up. As I'm going through these, guys, if you do enjoy the live Q&As, please join the exclusive access link below, because like Juanita's is saying, the link is below. That way you can access our Zooms, and it's actually quite fun in our group. So Finley, I went through this with an abdominal hysterectomy. I knew I had an SSRI starting after. Well, so what she's saying is that it sounds like, and correct me if I'm wrong, Finley, that you had maybe some abdominal pain concerns rising in the context of a challenging surgery, to say the least, and you had an SSRI coming down the pipeline because of what you were feeling. Unfortunately, it's a very classic story. Many individuals will benefit from that SSRI. You know that I'm not a particular fan of SSRIs that are overprescribed. But anyway, putting my judgment aside, yeah, it's a common occurrence that doesn't always address the root cause. William Thomas was in the ER a month ago with facial paralysis. Other motor functions were fine. Those ER docs didn't mess around. And I hope, William, that you had that issue at least resolved, or the appropriate management was taken to help resolve it. And oh my gosh, I'm sorry, random that there's a hole in your niece's leg. I hope that they get better from that. Donna had a UTI and ended up with sepsis 2 weeks ago. That's something that can make you really sick. Exactly. So the connection between the UTI and the pyelonephritis is that if the urinary tract infection is not treated, the infection can literally crawl up the urinary tract and end up into your kidneys, which is exactly what, unfortunately, Donna is sharing. I hope that you're doing okay now. Woke up. Once a root canal is infected, and depending on the specific tooth, it could cause a host of issues. Absolutely, especially if you are immunocompromised. Autistic Autumn, good to see you, and good afternoon to you in my time in San Francisco. I worked in nursing. I became sick after an operative breast infection. I went to a smaller level ER and was given antibiotics. Told to go home. Oh my gosh, I am so sorry that you had that. I'm not saying all misdiagnoses are gaslighting, but certainly there can be a large overlap that we as doctors and that you as patients should be aware of so that we can all do a better job. That's all that we want. I don't even know what to say about Booger's username there. Question, says Courtney, is it medical malpractice if a doctor does a procedure to a patient with a history of seizures and during the procedure the patient has a seizure? Certainly no, certainly not, because many seizures can come from any host of procedures. If something was done incorrectly to provoke the seizures, or if the wrong procedure was done, for example, those can be grounds for malpractice, but it becomes pretty dicey pretty quickly. Donna, thank you so much for the super thanks. Very, very kind of you. Appreciate it. Thank you, Heidi. I appreciate that as well. Let's see. I'm trying to keep up with all these comments coming in. Janet Hill, if the UTI is real bad, the ammonia level can make you hallucinate. Well, that would be a pretty raging infection there. Let's see. Jeremy says, can you tell me why I aspirated when getting my breathing tube removed after surgery? Jeremy, when someone has a breathing tube in place, if stomach contents is coming up in that process without the breathing tube in place to block stomach contents from going into your trachea, because when that tube is there, it's like an occlusive barrier. It's preventing food that gets vomited from going into your lungs. Once the tube is out, though, you can theoretically vomit and stuff can be aspirated. If that's what happened to you, I really hope that you're doing better now. Why do doctors love hydromorphone over a morphine drip? For many different reasons. It's not one size fits all. And morphine has a lot of side effects off it. It can be nasty, lots of hives and itching. Yeah. The liver issues can theoretically be an issue as well. Typically not an issue for most short-term pain infusions. Jeremy, you are so welcome. Meredith, I can't believe my granddaughter called for her birthday. I'm going to have to rewatch. I had questions. Okay, Meredith, well, I hope that we can answer them soon. Hey, Debbie, you're so welcome. I'm not giving advice, so just to be clear, it's medical information. I can't give medical advice over social media information, but I appreciate the ethos. Thank you. And Gabby, you're so welcome as well. Same to you, Janet. Jay Stone, nodules showed up in my lungs. Doctor blew them off as they found I had kidney cancer. Still no attention to the lung. Okay, so exactly what we're talking about. Things get lost, especially if there's multiple other things going on. And of course, I'm not saying that anyone should ignore the little things. We need to look at patients as a whole, but you can see how easy it is for important things to be dropped off. Knowledge is key. I agree, Wendy, and it's so good to see you. Shannon says, the next day, my husband took me to a further away hospital, and within an hour, I was rushed into an ER for intestinal and bowel strangulation. Oh my goodness. I'm sorry that you had that happen, Shannon, but I'm grateful that you were able to go to get a second opinion from what it sounds like. That's why sometimes these are necessary. My goodness, stay Star Baby online. Good evening and thank you. You're welcome. One of your other videos suggested bringing a notebook into your visit if you're anticipating a problem. I did it on Monday and it worked brilliantly. The doc paid attention. Yes, it worked. As you know, bringing a notebook. I recommend that over jotting notes on your phone, because on your phone it just increases the power delta or the discrepancy, because maintaining eye contact is key to leveling the playing field. And if you're on your phone, not only is it like, not only pardon, not only is it taking away eye contact, but it's also like bringing you down physically. Yeah, writing in a notebook, you're also kind of looking down, but I believe in my uninformed, unscientific methodology here that there is a profound difference between a notebook and a phone, whether you're a millennial or not. Oh, Shannon was called a drug seeker from the first hospital. So yeah, you didn't even go into this today, but drug seeking is challenging, right, Shannon? I'm so sorry that happened to you. Every doctor that I know of has been burned by a drug seeker in the past. It does not condone what you went through. Absolutely not. It is so challenging for everyone. But at the end of the day, I believe we need to err on the side of treatment, obviously. I shouldn't say obviously. I believe we need to do what it takes to not miss bowel strangulations. I mean, come on, you can't miss that. That's just so inappropriate. I don't know what workup happened in the first hospital, but I'm grateful that you're doing better now. And I'm so sorry you had to go through that. Straight Talk, good to see you. You are so welcome. Miss Eyes, file a complaint with a hospital administrator. Doctors have access to databases. They know who the seekers are. So this, there's no database for seekers, but it is certainly, I guess there's a couple of points that she's bringing up, or he or she, I don't know, Mrs. Eyes. I'm assuming a she, but in San Francisco, I can't assume, whatever. Whatever Mrs. Eyes is saying, you don't want the term seeker to be incorrectly put into your drug chart. That's not good. I agree with that. We want to advocate for ourselves. We want doctors to know really what's going on. And if a doctor incorrectly puts seeker because of an error, you want that to be removed. So I'm in full agreement with that. Hey, peekaboo, cockatiel, you're so welcome. Cynthia was saying, through years of surgery and chronic pain, I now find I'm battling deep depression. I feel like I've lost the will to fight. I'm sorry. This is why our words in medicine matter. It's why as patients, our words to ourselves matter. And if we perpetuate what others have told us in our own self-talk, it can rob us of precious resources as well, needless to say. You don't deserve that. I hope that you can find a healer who listens to you there, Cynthia. I'm sorry about what you've gone through. I hope you can use these strategies to better advocate. Cheryl Cat, my husband wants me, well, I will never be well attached to my health problems. Sorry, I'm not following up on that. Is it normal for operating rooms, asks Janet, to play soft music to the patient so they don't hear the staff talking? That's not the purpose of playing the music. It's often to help quiet the individual's nerves. And Renee, I am doing well. Thank you for asking. And thank you again, Cynthia. Juan, after being diagnosed with breast cancer, I experienced so many negative things in the hospital that now I can't bring myself to trust getting surgery. And this is exactly the type of story like that patient that I mentioned who's coming in for surgery. When a medical PTSD, or we don't even have to use the word PTSD as a label, when there has been a betrayal of trust, that's how I describe it to my patients. Continued or compounded betrayals of trust. It makes us less likely to seek life-saving interventions, makes us less likely to advocate for ourselves. And if we don't advocate for ourselves, I don't think anyone is going to be able to do as good of a job advocating for your health as you. And that's why these words matter so much. I do believe ketamine has a powerful role. It says wakeupthesouls.com. It has to be used medically appropriately. That's what I do in my clinic with my patients. So I am perhaps partial, but I have found incredible benefit with that. Moving on. Slam Bang Wallop. That's an incredible username. Isolation caused by CFS, referring to chronic fatigue syndrome or myalgic encephalitis, is very painful. Cannabis use for helping deal with it shouldn't be considered seeking behavior unless you smoke it, maybe. Well, it's a tough one. It's obviously challenging, CFS, or ME-CFS as we call it. I hope that you have a doctor who is familiar with ME-CFS and maybe has provided strategies to help you overcome those symptoms. I can't condone cannabis officially. In some cases, it is very useful. In some cases, it is not useful. I've had patients in the operating room have very, very dire consequences from smoking or consuming a lot of cannabis. So, like any powerful medication, we need to respect its use and use it properly. I'm sure we all agree with that. Nothing should be taken willy-nilly that we're putting into our bodies. Mary, you are so welcome. And Shannon, I'm grateful that you have found ketamine for your CRPS. Meredith says, hard though, when we advocate and family advocates and they kind of brush you off like you are crazy. Well, that's why I'm sharing these strategies from earlier. I hope you get a chance to watch that, Meredith. Lori says, why does a hospital transfer you when asked by son or parents? I don't know what you're referring to, Lori. I'm sorry. And Michael here has experienced awake intubations. They are traumatic. I've worked with ketamine in my patients to help them overcome the trauma of being intubated or extubated or having a breathing tube in place while awake or semi-awake. I agree it can be incredibly damaging. And I hope that if it has happened to you, Michael, that you've sought appropriate care to help overcome it. So many really powerful comments. I'll end with Wendy here saying that I hate getting labeled. And I'm with you, Wendy. None of us deserve to be labeled. And if you have been labeled, I hope that you can speak up. Even I'm not saying you need to confront people in an aggressive way, but asking what's the plan? What's the worst thing this could be? Why isn't it that? Sitting at eye level, bringing the notebook, making sure you're wearing your normal clothes, maintaining the eye contact. These are all strategies to hopefully minimize the risk of being labeled. And if you do have the opportunity, which isn't always there, to seek a second opinion or switch doctors, I hope that you feel empowered to do that. Until next time, remember that you all have more power over your health than you've probably ever been told.